Okay, so we're going to look at A2 immunity for CCEA. The first part of this topic is looking at different pathogens and it's describing sort of what pathogenic means. So a pathogen is something which will cause harm or even death or disease to the body. Okay, and there are certain things that the body has which act as the first line of defense. And it talks in, or mentions in specification about things like the skin, which provides a physical barrier to pathogens entering the body. If they do get in, there are enzymes called lysozymes, which you find in tears and saliva and sweat. They're antibacterial and are able to digest the cell walls of bacteria. Also, if they do get into a respiratory tract, then in the epithelial lining, it is covered in mucus, which can help to trap the pathogens and stop them from getting into cells. There are also cilia, or the tiny hairs in the respiratory tract, which sweep up the mucus, or sweep the mucus back up through the trachea. Also, if they get into your digestive system, into the stomach, there is hydrochloric acid, which will help to denature the enzymes within the pathogens and kill them off. Okay. There also refers to non-specific and specific immune responses within the specification. Non-specific is really to do with phagocytosis, which we'll take a look at now in a second. And then the more specific immune response involves lymphocytes. Okay, so phagocytosis we can see on screen here. This is your phagocyte or white blood cell. Here's your pathogen, which can cause disease or potentially death. Phagocytes recognize that these pathogens are non-self cells, so they haven't come from the body, they've come from outside the body. And essentially these phagocytes engulf these bacteria through phagocytosis. Okay, so essentially that means that their cell membrane forms around the pathogen and it engulfs it. It forms a phagosome, so it puts a membrane around it. It releases these lysosome enzymes, or lysosomes move to the area and they break down the pathogen using enzymes, and then that can be digested. Okay, so that's the non-specific immune response. Then the specific immune response is, as I've said, you have self and non-self cells. Self cells and non-self cells have antigens on the outside of them. Ones that come from inside the body are recognized, those antigens are recognized. Ones that comes from outside the body, those antigens are recognized as foreign. Okay, as I said, it involves the lymphocytes. You have two different types of lymphocytes. You have B lymphocytes, which are involved with producing antibodies and the antibody-mediated immunity. The B lymphocytes are formed, as you can see, in stem cells in the bone marrow, and they develop in the bone marrow as well. They're involved with antigens which are found in body fluids. Okay, so antibodies are produced by the lymphocytes and they respond to foreign cells or pathogens in body fluids. T lymphocytes is the other type of specific immune response. Or the other type of lymphocyte. Again, they're formed in the stem cells in the bone marrow. They mature in the thymus gland, which is in your neck. They're involved with cell-mediated immunity. So essentially that means that they look after antigens which are attached to or found within body cells. Okay, so viruses and things that get into the body cells. Okay, these two types of cells or lymphocytes respond in different ways. Okay, so we talk about the lymphocyte being activated. Okay, if you think here is a cell which has been infected by a virus. Okay, so there's the viruses within the cells. Those cells will offer up generally one of the spikes that you find on the outside of the virus, they will offer that up at the cell surface membrane. Okay, and then T lymphocytes, of which there are many different types floating around within the body, will recognize, or they'll be drawn to these antigens on the cell surface, which the T lymphocyte, which are complementary to those, will bind to it. Okay, and once it is binded or is complementary to that antigen, then it's known as being sensitized or activated. Okay, once activated, it will divide by mitosis and produce clones of itself, and then these clones, as you can see, develop into 4 different types of cells. You have killer T cells, which destroy infected cells, which have antigens within them or have pathogens within them. Okay, and they break that down by enzymes. You have helper T cells, which stimulate other cells involved in the immune response. For example, some of the B lymphocytes, the B plasma cells, as we'll take a look at in a second. You have suppressor T cells, which, as it suggests, suppress or dampen down that immune response. Okay, and once most of or all of the microbes or infected cells have been destroyed. And then you have memory T cells, which are the ones which stay within the body for a long period of time. And if the same antigen or same virus comes back, then they can respond very quickly for that secondary infection. Okay. The other type of lymphocytes then are the B lymphocytes. And as you can see, again, they are sensitized once these bonding sites bind with the antigens on, in this case, a bacteria. Okay, so they can see there's a complementary fit there between the B lymphocyte and the antigen. Again, the B lymphocytes, once sensitized or activated, will divide by mitosis. They produce plasma cells, or they develop into plasma cells, which produce antibodies. And you also have memory cells, which stay within the body and can respond to that secondary infection. Okay, in terms of the plasma cells, as we said, they produce antibodies. The antibodies then clump to the pathogens. Again, they're complementary, these antibodies, in shape to the spikes of the virus or the bacteria. They will clump them together, and then macrophages come along and they can engulf them. Okay, and that's seen in the little animation which you can see here. So there's the antigens. You can see the antibody will bind to, is complementary to these antigens on the cell surface. It can bind to those, and it acts as a marker, and then those macrophages will recognize that marker with the antigen, with the antibody attached, and then it can engulf and break down that infected cell. Okay, then we go on to talk about passive and active immunity. Passive immunity basically means that antibodies are received from somewhere outside the body, so it doesn't involve the body making antibodies, whereas active immunity involves the body responding to an antigen. Okay, and there are a number of different ways for that. In terms of passive immunity, different types of passive immunity. So some antibodies pass from the mother to baby across the placenta, or also in the first milk, which is taken on by the baby, which is called colostrum. And that is a way that the body or the baby can have immunity to certain diseases by having antibodies to kill them off. Another way is if a serum is injected. Okay, so if the body is infected with a form of disease and we have antibodies that are complementary to that pathogen, then those antibodies can be injected into the body, kill off that disease, but it does not give long-term immunity. Okay, another way, or a way of producing those antibodies, is by monoclonal antibody production, and that's done by what you can see on screen here, the method. So you infect, in this case, we tend to use mice for these, or small mammals, because they're easily stored and they don't have as much of a sort of human attachment as things like horses and things would, but they're injected with a specific antigen, so one particular antigen, okay? So they will then respond to that, or the B lymphocytes will be sensitized to that and will respond by being dividing by mitosis and producing your plasma cells, etc. So these can then be extracted. Okay, unfortunately, these B lymphocytes, plasma cells, are short-lived, so therefore they're not really that useful. So what we can do is we can fuse them or hybridize them with tumor or cancer cells, which are longer-lived and divide very quickly. Okay, so that gives us these long-lived hybridoma or hybrid cells, which will then produce large quantities of antibodies, and those antibodies are known as monoclonal antibodies. They're antibodies for one particular antigen, and they've come from these cloned plasma cells. Okay, examples of that in real life, you can see when Donald Trump detected or was infected with COVID in the early stages, he was treated with these monoclonal antibodies produced by that method. And you can see there another patients treated with antibodies. That's a bit like the serum. Okay, again, it doesn't give you long-term immunity, because if you're injected with these antibodies, then the concentration of those antibodies in the blood increases. After a number of, could be days, could be weeks, that concentration will drop off as those antibodies are broken down. And then if you're infected, let's say over here, with the same antigen or same pathogen, you don't have those memory cells, you don't have antibodies within the blood, you'd need to have another injection. Okay, that links in with the next bit, which is looking at the primary response and secondary response. Okay, so this is linked to active immunity. So active immunity tends to be if you've had a disease or if you've had a vaccination. Okay, so in this case, it could be that you've had the disease. So there's initial exposure to a particular antigen. It will take you a while for your B lymphocytes to recognize that antigen, produce the plasma cells, and then produce antibodies. That could be up to a few days, could be a week. You will then produce those antibodies, which will hopefully get rid of that infection or kill off that antigen. Then the number of antibodies in your blood drops off. Okay, and because you have the memory cells there produced by those B lymphocytes, they will stay in your blood for weeks or years. If the same antigen, and it has to be the same antigen which is complementary to those antibodies, then gets back into the body, so a second a sort of reinfection or second exposure you can see there, then it's a very rapid increase in the number of antibodies. So those memory cells will produce copies of themselves and plasma cells, which can produce antibodies very, very quickly, which kills off that infection maybe before you even know you've had it. Okay, and the level of antibodies then in the blood stays reasonably high. Okay, so there's your different types of immunity that we have. We have the passive immunity that we talked about first. So either from mother to baby via placenta or via that first milk, or by that sort of serum, that injection of antibodies. The active immunity occurs really when you've either had the disease or when you're given a vaccination. I suppose that last graph could be your first vaccination jab here, and then it could be a booster later on, a number of weeks later, as with COVID, then that gives you that higher level of antibodies within the blood and provides you with that immunity. Okay, the next part of this goes on to talk about blood transfusions, okay, and talks a bit about transplant tissue. So when you're transplanting tissue between someone, let's say, that's ill, that needs a new kidney, or other tissue that can be transplanted, then you have to weigh up the risks, and you have to try and link in the transplanted tissue with the person who's receiving it. Okay, so if you're on the receiving end of having a transplant, then obviously your immune system, there is a danger that your immune system will see that tissue, that transplanted tissue, as non-self. It will then have an immune response to that and could, in a way, kill off that tissue or reject the tissue, as it's called. Okay, so again, your T lymphocytes, your killer T cells would attack it. Okay, one way of getting over that immune response is by tissue typing. And generally that's looking within the family for somebody that would transplant, let's say, a kidney to another family member. And because the DNA is very similar there, it might be that it doesn't produce an immune response. There are also immunosuppressive techniques like drugs and X-rays. So you can be given drugs which will inhibit DNA replication and stop those T cells replicating. So it doesn't attack the transplanted tissue. Also, X-rays can be used, and that will inhibit the production of lymphocytes as well. Okay, there's a sort of balance here in that you have to weigh up the risks with the case, with the also the risk of transplant rejection. Okay, so if the level of immunosuppression, so think of this as drugs, if the level of immunosuppression or the concentration of the drugs given to the patient is low, there's a high risk that T lymphocytes will reject transplanted tissue. Whereas if the level of drugs given, immunosuppressive drugs given to the patient is high, it can have these side effects, okay, but then the risk of rejection is lower. So it's trying to weigh up that balance. Then we go on to talk about blood transfusions. So if somebody's been injured and has lost a lot of blood, they can be given blood to replace that. There are 4 different blood types: blood group A, blood group B, blood group AB, and blood group O. Okay, because they're cells within the body, they do have antigens, okay, on the red blood cells, and some of them will have antibodies within the plasma. Okay, now you can see here blood group A has got antigen A on the red blood cell, and it has got anti-B antibodies in its plasma. So if that blood group, if that person of blood group A receives blood from somebody who is blood group O, it will have antibodies to attack it, attack those sort of non-self cells, or those blood group B cells, and coagulate the blood. Okay, if you're blood group B, you contain antigen B on the outside, so slightly different, you can see there, than antigen A, and you will have anti-A antibodies within your blood plasma. Okay, so again, if you're blood group B and you receive blood from somebody who's blood group A, you will have antibodies then that will attach to these antigens on the surface and cause coagulation of that blood. If you're blood group AB, you don't have any antigen, sorry, you have antigens for A and B, as you can see on the red blood cells, but you don't have any antibodies. Okay, so they can receive blood from anyone, okay, without attacking it. If you're blood group O, which is the sort of rarest one, you don't have any antigens on the red blood cells, but you do have antibodies for anti-A and anti-B. Okay, blood group O are the sort of universal donor because they can give blood to anybody because they don't have any antigens on their blood. Okay, and you can see that from the table below here on screen. If you're blood group A, so the recipient at the top here, blood group A, you can receive blood from blood group, another person, a donor who's blood group A or blood group O. Okay, not from B or A and B. Blood group B, if you're the recipient, you can receive blood from somebody who's blood group B and blood group O. If you're blood group AB, you can receive blood from anybody because you've no antibodies in the plasma. Whereas if you're blood group O, you can only receive blood from somebody else who is blood group O because you have anti-A and anti-B antibodies. Okay. The next bit of this then goes on to talk about the rhesus factor or the rhesus system. It's similar to the antigens A and B, except this is an anti-D antigen, which you can see on screen here. So if you're rhesus positive, you have the antigen D on your red blood cells, but you don't have any antibodies or anti-D antibodies in your blood plasma. If you're rhesus negative, then you don't have the antigen on the red blood cells, but after your lymphocytes have been sensitized, they will produce anti-D antibodies in their blood plasma. Okay, and this becomes apparent or is important during pregnancy. Okay, so if the father is rhesus positive, mother's rhesus negative, there is a chance then that the baby can be rhesus positive with a rhesus negative mother. Okay, nothing happens during really the first pregnancy, but during that birth process, some of the baby's blood, that rhesus positive blood with the antigens on the red blood cells, may leak into the mother's blood. Okay, so during the pregnancy or during delivery, that will sensitize her B lymphocytes, and then they will produce these anti-D antibodies. Okay, if there's a further pregnancy, that means then that if these antibodies can be produced by her memory cells, which could then attack the baby and kill the baby off. Okay, and you can see that sort of happening here. So if the first pregnancy is rhesus positive, she will produce antibodies. If the second pregnancy or third or fourth pregnancy, if the baby is rhesus positive and her lymphocytes become sensitized, she will again produce antibodies, which can affect the baby or kill off the baby. Okay. Now, what they do to get over that nowadays is they inject anti-D antibodies. Okay. And if they inject the antibodies, then they will attach to any blood that leaks into the mother system from the baby, which means that then the memory cells which she has aren't sensitized. So therefore they won't produce antibodies within her body and attack the baby. So it's a bit like a serum is injected with those anti-D antibodies, and it will attach to any red blood cell fragments that may pass across the placenta. Okay, the next bit of this is looking at antibody resistance. Okay, so within bacteria may develop resistance to certain antibiotics. Okay, and antibiotics really are there to kill off bacteria, as we know, and they either really break or disrupt the cell wall formation, or they can inhibit metabolic processes within the bacteria, including protein synthesis, which stops the bacteria multiplying. Okay. Unfortunately, some bacteria develop resistance to these antibiotics, and that can lead to then antibiotic-resistant bacteria. Okay, so here you can see at the top, most of the bacteria are not resistant. If you apply your antibiotic, it will kill those off because they're not resistant. Okay, unfortunately, small numbers may have slight mutations which cause resistance. So it means that if you apply that antibiotic, then it'll have no effect, which means that bacteria can then multiply and pass on that resistance to the next generations of bacteria. Okay, Mrsa is an example of a bacteria which is resistant to the antibiotic methicillin. It's a bacteria called Staphylococcus aureus. They caused a number of deaths back in the early and late 2000s. Okay, in hospitals generally, and that was really because of lack of cleaning techniques between or within hospitals. Okay, so sanitation has got much better within hospitals now. People wash their hands more regularly, either visitors or doctors and nurses between patients, and that has led to a drop in this antibiotic resistance within hospitals. Okay, The next bit of this then goes on and talks about factors affecting the spread of disease and talks about pandemics and epidemics, which we know a lot more about now. Viruses tend to be the major cause of epidemics and pandemics. That's because they have very small genomes or very small bits, sections of DNA, which can mutate very easily. A number of these viruses are retroviruses, so they have RNA, which is then makes them a bit less stable than the ones that have DNA within them. And also viruses, antibiotics have no effect on the viruses. So that can cause them to spread more easily. Okay. The last sort of bit of this is about diagnosing infection, and it's using trying to think of more accurate and more earlier methods of diagnosis. Okay, one way of doing this is using this ELISA, which stands for an enzyme-linked immunosuppressed immunosorbent assay. Okay, and essentially that is using different colors to provide markers for certain diseases. Okay, so samples are taken through either blood or body fluids. Those samples are then put into these little assays or little containers with certain chemicals within them. If it changes a certain color, then that is a marker for different types of diseases. Okay, and it's a much more rapid than the conventional way of working out if somebody has had a disease or not. Okay, obviously where this is quite common for us at the moment with our lateral flow tests and things, and also pregnancy tests as well, which give you that early indicator of infection or pregnancy as well. Okay, so you provide your sample, there's a reaction that occurs which involves a number of enzymes, and then that causes these bands to change color, either giving you the positive or negative test, and exactly the same for your pregnancy test. Okay, quite a long topic. Hope that helped with the immunity revision. Thanks, bye.